morning, everyone. Thanks for joining our panel discussion this morning. You may have been on the last one that we did with Prostate Cancer UK, but we're really delighted to be following that up with another discussion, because I think we had so much to talk about before, and we got so many questions that we felt that it warranted another discussion. So we are really delighted to be hosting this follow-up webinar this morning, and we're going to focus primarily on the mental health impacts of a prostate cancer diagnosis. So again, we're joined by our panel of experts who I'll introduce shortly, and we're going to be talking about the complex relationship between mental health and a prostate cancer diagnosis, how mental health can be affected by treatment, and also the importance of emotional support. Will be myself and Laura James from Prostate Cancer UK will be monitoring the chat and the question and answer function throughout this discussion. So if you want to submit any questions, please put them in the Q&A, because that's where we'll be able to see them. We can respond to them, or we can put them to our panel of experts. But we also encourage you to share any thoughts or experiences that you've had in the chat as well. So hopefully this is going to be a really good discussion on mental health and prostate cancer. And we've also got a slide at the end with all of the information on how you can contact Prostate Cancer UK. So I will start by introducing our guest panelists today. So my name's Emily Cook, I'm a business psychologist with Thrive, and I'm going to be hosting today's session and asking all the questions. And we're also joined by Dr. Andres Fonseca. So I'll come to you first, Andres, to introduce yourself.
Hi, everybody. Good morning. I'm Andres Fonseca. I'm the CEO and one of the founders at Thrive. I'm a consultant psychiatrist by training, and I worked for a long time with I mean, I'm both an adult and an old age psychiatrist, and the transition between those two is what I've spent the majority of my career clinically. So I encountered a lot of men that were going through the process of perhaps worrying about prostate cancer, having diagnosis, and then considering treatments. And this was sometimes related to the diagnosis. Sometimes I was looking after them, and this came up because it's such a frequent, such a dominant cancer that is frequently encountered by men at particularly the age that I was interested in during my clinical work.
Brilliant. Thanks, Andreas. And then we've also got John Robertson from Prostate Cancer UK. Hi, John.
Hi, good morning, everybody. It's lovely to be here. As Emily says, my name's John Robertson. I've been working as a nurse for over 40 years now, and I've been with Prostate Cancer UK specifically in my role as specialist nurse for the last 13, 14 years.
Great, thanks, John. And then also we've got John Rebholz as well. Hi, John.
Hi, guys. Morning, everyone. Honoured to be part of this panel again. My dad lived through 4 years with advanced stage cancer, and through sort of lived experience, we found out more about it, and I would like to share and kind of raise awareness of it, especially with links to the family history side of things. I am deemed 4 times at risk than the common man out there. My father's father passed away as well through prostate cancer, and his brothers had it as well. So yeah, I'm here to help.
Brilliant. Thanks, John. And then I'm also joined by Laura James from Prostate Cancer UK, who's going to be helping me monitor the Q&A, and we'll probably be able to respond to some of your questions as well as they come through. So Laura, do you want to just briefly say hi and introduce yourself?
Sure, thanks, Emily. Hi, everyone. I'm Laura James. I'm Head of Clinical and Peer Support Services at Prostate Cancer UK. I work alongside John in the specialist nurse team. I'm also a specialist nurse myself, and yet really happy to be here today, and looking forward to hearing what everybody's got to talk about.
Great, thanks, Laura. All right, so I'm going to stop sharing my slides now, just so that you're not looking at a presentation and you can see everyone's faces really well. So just to kickstart our discussion, obviously last time we talked quite a lot about, quite in depth about prostate cancer, you know, the condition itself, what that entailed. But we really want to understand the link between mental health. So my first question to our panelists is, how does a diagnosis of prostate cancer impact mental health? Can I come to John, you first, and then Andreas? We'd love to hear from you as well.
Yeah, sure, Emily, thanks very much. I think in terms of, it might be useful to try and gauge the kind of impact that a diagnosis of prostate cancer has in men. I was interested to see that a team from King's College Hospital in London had a look at this in terms of the publications on all of it. So they did a big meta-analysis study of what it was saying, and what came out was quite interesting. Their findings were that as many as 17% of men given a diagnosis of prostate cancer presented with quite severe depression symptoms, and a similar amount of men were presenting with severe anxiety as well. And that's certainly in keeping with what we find when we speak to men. And if we look at the figures, which is something in the order of 400,000 men currently in the United Kingdom are diagnosed with prostate cancer, you can then do the maths yourself. If we're talking about 400,000 men and 17% of those possibly may present with significant mental health issues, then you can see it's a huge number of men that this impacts on. And, leading on from that, what we find when speaking to men, as I've been doing for, as I said earlier, 13, 14 years, is that men will call us who haven't been diagnosed with prostate cancer, but perhaps are undergoing investigation for it. And that in turn creates a huge amount of stress and anxiety in those men. And I often say to them that that can be the most difficult period, because once they've had the diagnosis, moved on to treatment, they at least feel that they know what they're up against. I think similarly, those men that go on to be diagnosed with prostate cancer, whether it's at an early stage or an advanced stage, as John's dad found, then that has a significant impact. We know that the impact that the word cancer has on people in general, and the media certainly go a long way to kind of, I would argue, raise the concerns and fears around the word cancer. And that's certainly borne out by the men that contact us.
Brilliant, thank you. Andreas, what have you observed through your experience of working with men in sort of psychiatric services who've also been going through that experience?
Yeah, no, I mean, the numbers that John is reporting are the ones that you tend to that you tend to find when people are undergoing the screening and early testing. If you consider the whole journey of somebody that has screened or being treated or is undergoing that whole process, the number can be between 20 and up to 60%, depending on what's serious and in what circumstances. So, even in the initial stages, as John was saying, you can not even be diagnosed. You could just be going through that screening, and that in itself is quite anxiety provoking. And in the clinic, what you tend to see is, maybe you have a man that you're looking after that has a history of depression from previously, and that you're just monitoring in the clinic, and this whole process may increase the risk quite dramatically of relapse with them. So you have to pay particular attention. Also, I mean, I was interested to hear about John's family history, because the risk of a mental health condition in people who have had relatives with going through prostate cancer is actually much higher than in the general population that might be undergoing this screening and testing. It's around 2 to 3 times higher in those people that have a family history and that have had it in the family. So the two most frequent conditions that you encounter are, of course, depression and anxiety. Anxiety in particular seems to have the highest incidence and the highest risk as it were. Knowledge, information, so the type of things that Prostate Cancer UK does all the time is one of the things that has the biggest impact in reducing that anxiety. But also just being aware that you might experience the symptoms and that they might be significant, and that you might need to seek help in your own right for them, separate from the cancer, hopefully in a coordinated way, but separate from the cancer, is also important, because we know that cancer can modify the cause of, the depression and anxiety, particularly depression, can modify the prognosis of your cancer diagnosis. So if you have depression in particular, your prognosis can be worse by around 10 to 20%. So 10 to 20% more cases of poor outcomes with depression untreated. Now, it's interesting to know that if you do treat it, and it's perfectly treatable, it's the same methods that we would use in depression would work, good psychotherapy, medication if needed, that approach does work very effectively, and brings that risk back to normal in your treatment for your cancer diagnosis, for your prostate cancer. It's interesting that also prostate cancer seems to have higher risk. We were talking about cancer being a big word and being quite scary, but prostate cancer in particular seems to have a higher risk of these conditions than other forms of cancer in men. So that's also worth bearing in mind.
Brilliant. Okay, thank you. And I think we will come on to the sort of effects of treatment on mental health and vice versa as well a bit later. John Rebholz, are you able to come in and share your experience as well? Because I know when, in the past when we've had conversations about your experience and your dad's experience, this was quite a significant part, wasn't it, of sort of dealing with that journey, was the mental health impact. So are you able to share any of that for us?
Yes, thank you. Absolutely. So, I mean, my dad was diagnosed terminal right from the outset, and obviously that kind of had a massive impact on his outlook. He was a very positive man. There were feelings of frustration and anger that the system had kind of let him down. He knew full well that there was a strong family link. I don't think the science back then, say 10, 12 years ago, was anywhere near that it is now. I'm not so sure that even family links were even thought about, but he went to his doctor. I think the process really kind of let him down. And after the initial diagnosis, he then went on to have treatment, and initially worked very, very well. He had potentially about 4 or 5 different treatments throughout his journey, and it was a journey, and each one had its varying impact on his health, and that related to his kind of mental outlook. So, for example, when he was first given treatment, that worked very well for about 12, 13 months, and he even started to kind of stabilize, and he started to lead a kind of more normal life. And then obviously the illness got slightly worse, and there was less in the locker to treat him with. And I think he started to realize that. I think, that his journey was coming to an end, and the symptoms that he had, around pain, just took away the will to fight. And I think, I know sometimes that he was in a very, very dark place, and with his era, men don't really want to talk about it. And I can remember a few times going around to see him, and he was on his chair, turned around, just watching the TV, just staring into space, just contemplating things. And we had a loving family around him. He had lots of support, both mentally, physically, emotionally, and that's all that that we could have done. And then I think really the next stage for like me really that was kind of noticeable was when it started to impede his natural ability to do what I call normal functional things like walk, because the prostate cancer spread to the bones, and he wasn't even able to walk properly. He couldn't go to the toilet without help, and this, I think this affected his kind of like manly sort of persona, and it did terrible things to his mind. And we did actually have a kind of family plan in place that we discussed away from our dad. And I think it's good, you know, for families to have an action plan, just depending on, you know, where that diagnosis is. If it's early and it can be curable, you know, brilliant. Then the plan's more positive. But if it's more kind of aiming in the sort of terminal direction, I think there is lots still that can be done, such as palliative care. And he went through an array of treatments, as I've just said. But I think really at the end of the day, I think he never gave up really. And I think it was just the pain that really got to him, and it just curbed his every sort of day-to-day function. And he lived literally for every individual day. He would fight that day, and he wouldn't look further than the next day. Yeah, so that was my sort of observations of it.
Brilliant. Thanks for sharing that, John. And also, in terms of the current context that we've been in over the past 15 months, we've seen an increase in anxiety over the past year in general. So I think that's been very difficult for people to cope with, especially if they've also had chronic health conditions that they've been in treatment for or going forward for diagnosis. John Robertson, when we were kind of talking about preparing for this session, you talked about that in terms of how that's impacted people's help seeking going forward for asking for even emotional support. Is there anything that you can sort of say on that? Have you noticed that people's anxiety has increased? Has that impacted the way that they've been coping throughout the past year?
Yeah, it's a really interesting point, Emily. And one of the things that I've been talking to support groups for the last 12 months around is how the pandemic has really, on the one hand, amplified people's anxiety and stress levels to a point which we weren't seeing previously. And as you say, that was pretty much in line with what the general population were feeling anyway. But I think the other side of that coin is that it's that conversation, if you like, that the pandemic has enabled us to have, both literally in the media day by day and to organisations like ourselves, is it's allowed us to kind of, if you like, verbalise mental health issues such as anxiety and depression and how men are feeling in a way that previously perhaps wasn't happening. And, you know, John touched on earlier about his dad and how, you know, men of his generation really didn't talk about these things. There's a report due out next year from the Lancet, the medical journal, which has put a commission together looking at gender and health. And, you know, we anticipate they're going to be focusing a lot on this in terms of men's health and how men approach things differently and perhaps are more reluctant to discuss it. And that's borne out by the calls that we get to the specialist nurse telephone service. I've had 2 calls this week, and it was a female partner that made contact who said that their husband was reluctant to talk on the phone. But then, of course, they were able to put me on loudspeaker, and I was able to have a conversation with both of them. So there are issues around gender difficulties and how we deal with health and mental health as well. And I think those are changing. And I think the pandemic has given us an opportunity to bring that to the fore. Although I don't want to kind of overstate that in terms of the massive issues we have, because those of you that were reading your press this morning would have seen splashed across it the fact that there's a huge big mental health crisis in the United Kingdom and in relation to availability and access to services. So that is going to be a huge pressure.
Brilliant, thank you. And we've definitely seen that as well in the last year. Something that I've noticed is that people are talking about mental health more openly. I think because we've kind of been in this collective experience, it's something that we can all talk about and we can all relate to. So hopefully that's a positive thing, and it's going to bring these conversations to the forefront. I think that there was a question in the chat that we wanted to put to you. Laura, can you share that with us?
Yeah, sure. John Robertson, this was one for you actually, but actually I think it would be really interesting to get everybody's thoughts on it. We've had a question from Kel, who's a 58-year-old gentleman, and has had a couple of PSA tests done, one that was 3.7, one that was 2.7, 6 months between them. But Kel was saying that he isn't aware of his family history due to sort of being adopted as a baby. So he was just really interested to know about, things to sort of do and look out for. And I think that's a really interesting one, John, just sort of thinking about uncertainty and if people maybe don't know their family history or something like that. So yeah, just anything you can suggest to Kel really would be great.
Yeah, it's a good question, Kel, and it's one that actually is not uncommon. When I speak to men on the telephone, and certainly over the last few years, I'm always surprised by the number of men who say, well, they were adopted and therefore they can't always follow back in terms of family history. I think all we can say is we can control the things that we can control. So being aware of risk factors for prostate cancer is really important. If anybody out there is not sure of risk factors, go onto our website in Prostate Cancer UK. We've got a risk checker. It's a very simple tool that you just put in information. We know, for example, black men have twice the risk of white men. We also know, as John was talking about, family history can also increase it. But if you're not aware of your family history, I think the same principles apply. If you notice a change in some symptoms that may or may not be associated with a prostate problem, our message is always don't ignore it. Don't just put it down to getting old. As men get older, they often find changes in their bladder function or whatever. It's really about having a discussion with your GP, checking it out. They can assess it and work out whether it's a bladder issue or a prostate problem, or whether indeed it may be an indication of prostate cancer, which could lead to further tests and investigations. So I think it's really important that, men like yourself, Kel, that you perhaps can't trace back your family history too much. That doesn't mean that you're kind of locked out of being in control of things going forward. Just be aware of the symptoms, and you can give us a phone and our telephone service, or check out the website. And as I say, have a chat with your GP about any issues you might be concerned about.
Thanks, John. Did John or Andreas, did either of you have anything else to add on that before I ask my next question?
I only wanted to sort of say that, your concern about your risk here, it's important to also be aware of how big the worry is and whether the worry itself is affecting you. So that's the other thing. So you're having the PSA tests. The urologist recognized that having a PSA number can be in itself anxiety inducing and provoking, and when you don't know exactly how to interpret it, that can get even worse. That's why John's advice is very good, to sort of go on the phone and discuss it through your specific case. But just to be aware of the anxiety itself may warrant its own attention. So yes, of course, you need to sort of worry about the risk, but you may have, if you're very worried about this, if this is affecting your life, you may have an anxiety condition that might be worth looking into as well. Health anxiety is very common, particularly we've seen it a lot in the pandemic. And if you're at risk, or you feel that you might be at risk of prostate cancer, that might be another risk factor for anxiety. Yeah.
Brilliant. Thanks, Andreas. So now we want to move on to the effects of treatment on mental health. And I think, Andreas, you kind of alluded to this at the beginning about almost a bi-directional relationship. So treatment itself can obviously have impacts on mental health. So would like to hear about that, but also how can our mental health impact treatment outcomes and so on. So Andres, can I come to you first on that, and
Sure.
then John Robertson, and then John Rebholz would hear from you as well, I think, from your experience.
Yeah, no, absolutely. And you're right to point out that bidirectional relationship. So we know that some hormonal treatments can have an effect on mental health. And it's important to sort of be aware of it, not because it's unavoidable, but because if you're looking at it, if you're screening for it, then it's possible to treat it in its own right and effectively overcome it. So it's very important. I mean, the biggest risk with treatment, hormonal treatment, tends to be an increased risk of depression. And in some hormonal treatments, the risk can be about, so the cohort can be up to about 50% of men being treated. So it's very, very important to be aware of it, to screen for it and to intervene early so that the man is not going to be affected by this, because there is that bidirectional relationship. So it seems that if you develop depression in particular during the course of your cancer, of your prostate cancer process, your outcomes might be worse. So it's important to address it and to treat it and to take it seriously. So there's that. I mean, I did want to sort of make a couple of points based on a couple of things that John said before, which is pain. Pain is also very, very highly correlated with depression. As I think John was talking from the point of view of his dad's experience. But it's important to know that pain can be addressed. And sometimes I don't think we do a very good job of addressing pain and improving quality of life. And pain can be addressed in a number of ways. Yes, there are pain-reducing medications that can be helpful and should be prescribed. I'm not sure how much access John's dad had to those, but also psychological treatments are very effective in chronic pain. Apart from alleviating the anxiety and the depression, they can alleviate the pain itself and improve quality of life. John was saying that, sometimes if it's caught early and the prognosis is good, great, fantastic. When the prognosis is not so good, there's also many things that one can do to improve that quality of life and to improve the experience of, for example, reducing that pain that is kind of life-robbing in many ways. So I think I did want to sort of make that point there.
Brilliant, thank you. And we've just had a comment in the chat from Richard that's said that his dad's recently started hormone treatment and has gone from a fit, strong, positive individual to very quickly losing his mojo and having a negative outlook on life, even though his prognosis is for a positive outcome. So I think that kind of is, links quite with what you're saying. And I guess it helps to just have that awareness of it as well. So, I think we've got a few people here that are family members of people that have a diagnosis. So just having that awareness and being able to open up that conversation and maybe even try and encourage them to kind of think about the emotional impacts as well, it is really helpful.
I did want to say one quick thing about the family and the carers. In men, there's this, I don't think we have strong enough evidence yet to sort of make case that there is a different type of depression or a different presentation of depression that is male only or primarily male. But there are case studies that do suggest that sometimes depression can present slightly differently in men, with more irritability, more self-isolation perhaps than in other cases, but also more, neglecting yourself, but also neglecting others, and being, shutting people off, or being quite aggressive and difficult to look after. And it's important that when you have a family member that is going through this, you also look after yourself if you're trying to support them. And to look at yourself, and in your own right, you might need to seek help for your psychological well-being and to understand what's happening to your family member, so that you can best support them and feel kind of strong and empowered to be able to deal with it. And also understand, that some of these things that they're doing is not because they are trying to be nasty to you or anything like that. They are part of their condition, and they might be part of the manifestations of their depression, for example.
Yeah, brilliant. And we've had a couple of people as well. I think that there's difference. I think it's important to say that, different people will deal with it in different ways. So some people will be able to, you know, remain positive and optimistic, and then others might not. And there's so many different factors that can play into that, aren't there? I also wanted to talk about the importance of emotional support during prostate cancer. Well, obviously we've kind of touched on that so far, but Andres, when we were kind of preparing for this, one of the things that you talked about was that initial conversation with a health professional about having a diagnosis of prostate cancer, and that sometimes mental health and psychological support isn't discussed. So can we talk about that? How important is emotional support during a prostate cancer diagnosis? Andres, so I'll come to you first, and then John Robertson, if I can come to you.
Yeah, so again, I think John Robertson was talking about this when he, you know, in his opening statement, that the risk around the process of screening diagnosis is quite high, particularly for anxiety, and actually it seems to go down when the diagnosis is made, whether positive or negative. Either one seems to reduce that anxiety. But it's very important to include that discussion in the conversation initially, and to screen for it, because as we said, it can change the course of the prognosis of the condition. So there are specific scales for, particularly for anxiety, but also for depression, to screen for the presence of these conditions in the context of prostate cancer specifically. So these can be used. I think there's one that is self-administered. It's called, what's it called? I had it in my notes. Anyway, there's a specific scale that deals with this, that can be used for screening, that adapts to the other changes that may come with the diagnosis. So basically, the problem that you have sometimes trying to find out if somebody's got anxiety or depression is that some of the symptoms of the condition itself may overlap, or even the treatment may overlap. So that's why a specific scale has been developed and is used for this screening. Nurses are at the very, I think the nurses are leading the research on this topic, on early detection and early intervention in mental health in the context of cancer, prostate cancer in particular. So I think that initial contact with the nurses that are following you up and having regular contact with you seems to be very important. It seems to be the area where we see the most benefits in this type of way of thinking and intervention.
Brilliant, thank you. John Robertson, can I come to you next on that? What are your thoughts?
Yeah, there's a whole range of thoughts, Emily, going through my mind. One of the things I want to touch on, first of all, is I think the idea of messaging, because one of the things when I'm speaking to men on the phone, and I think it goes back to Kel's earlier concern about PSA readings and the like, and the risk of prostate cancer, we publicise quite rightly the risk factors. So for white men, for example, we say the lifetime risk of getting prostate cancer is 1 in 8. And I speak to so many men who will ring us up and say, well, I know it's this figure, and that sounds like a really high figure. But when I have the conversation, I say, well, how do you feel if I say the lifetime risk is that 7 out of 8 men will never get prostate cancer? And suddenly that switch, that cognitive process has switched to where they think, well, I didn't actually look at it like that. And that can immediately act as a sort of de-stressor, if you like. And we know, I think, as Andreas was saying, you know, when men contact us, whether it be through our phone service or email or social media or live chat platforms, whatever, we often ask for feedback on it. And one of the things we ask is, how did you feel when you made contact with us? How do you feel at the end of that interaction? And, you know, significantly high numbers of people will say their levels of anxiety and stress and has gone down quite significantly. So, you know, I think that tells us in reality that actually reaching out to people, having that conversation does make an impact. And, you know, we're quite rightly focusing on today's talk on mental health and the impact it has in men with prostate cancer. But, you know, it's also important to recognise that mental health is not a static concept. It exists across a continuum. You know, we often feel, you know, perhaps better in the morning and our mood may dip in the afternoon or vice versa, just due to how we're feeling within ourselves, our underlying health, the environmental factors that may be going on. And another important feature, I think, to recognise is the role that isolation plays in mental health for many men with prostate cancer. I mentioned at the outset the kind of review of the evidence, and one of the strong points that comes through is people who are more isolated certainly tend to have much higher levels of mental ill health. And we saw that last year with the pandemic, where many more of us were isolated and being forced to isolate. And that came through in the calls that we were taking, that people were feeling isolated. So, you know, I also think we're seeing that in calls that we're taking now, although the services are beginning to reopen and people are re-engaging with their urologist or their oncologist about their prostate cancer treatment. For the last 15 months or so, partners have often been excluded from that interaction. And it is beginning to open up, but there are still major issues about partners being party to the discussions. And that in turn means that the partner may often feel isolated from that process and getting that information.
Brilliant, thank you. And then other John, you know, from your experience of being with your dad and his kind of terminal diagnosis, what kind of a role did emotional support play throughout his journey? And you know, can you offer any sort of insight from your own personal experience as well?
Yeah, I mean, I agree with all what the panelists have said. I know for a fact that the emotional support was invaluable. That's what really kept him going. It kept him positive, right from the sort of professional side of things, from the medical staff who were in constant contact with him through prostate cancer charity. They supported us. So if they supported us, they supported him, because we were all almost one team. We were always around him. And ultimately, there are dark times. And I think it's quite obvious from here that we are all individuals anyway. I think men tend to underplay their kind of mental issues anyway. And my dad was a very sort of keep it to himself man. And he did actually have a few very honest and open conversations with us, which we found difficult. Scenarios around, you know, what to do if the pain got too much. But, you know, we all play our part, and distraction comes into it to a kind of like certain point where you give them the best life possible. You know, we encourage for him to enjoy life still, to go places, to go visit family and friends, to submerge himself in that kind of like positive world. I know it sounds fluffy and cheesy, but if you take your mind off of it during these treatments, and these treatments are helping, it will make him feel human again. And that's what it's all about. And we were there to support him physically when he fell, to do the basic things in life. And I think he just appreciated it. Even when I was working, you know, just a simple text, "Dad, how are you?" And he answered me back straight away. And I know my dad personally, and he wouldn't have answered me if he wasn't ready to talk. But each day is different. So, you know, each day I'd say, "Dad, how is it out of 10? You know, how's your pain? How's your mood?" And sometimes I sort of say, "Look, my mood's 1 out of 10. It's not great." Sometimes you'd say, my pain is worse, but I'm feeling okay." It's a roller coaster journey. The only thing is that you are as good as the people that are around you. And it's nice to know that someone like Cal is taking health into his own hands and like being proactive with it. And I think if you're proactive, I think that alleviates some of the stress, because it's the not knowing, it's the big question. And whilst there's more awareness out there, it does feed into a bit of the sort of anxiety channels as well, because prostate cancer is more common these days. But you are doing the right thing. And I think it's nice to have also people phone in and join us with a chat who are members of families whose dad, father, sons are suffering too. And that's brilliant. So, yeah.
Thanks, John. And I guess linking on to that as well, and you kind of made a good point about, you know, you really were openly communicating with your dad and just having that sort of constant level of support there. I think there was a comment or a question in the chat from Richard. Laura, you had that there that you were going to put to everyone.
Yeah, Richard made a really interesting point about his dad had started on hormone therapy treatment and they'd noticed some changes in him. And one of the things they'd noticed was that at times he'd become quite snappy with Richard's mum, his wife, but the family are sort of finding it quite difficult perhaps to address that and to sort of say that to him, because obviously he's going through treatment. And I thought it would be really interesting to hear from the three of you, sort of John from the personal and John and Andreas from the professional, about maybe any tips or thoughts that you know you might be able to help Richard with to sort of start that conversation, perhaps maybe when somebody is maybe not acting a bit out of character or something, and you do want to sort of say something about that, but understandably there is that fear because of what they're going through. Be great to perhaps hear if you've got any suggestions for Richard.
Great question. Andreas, should we come to you first and then?
Oh, yeah. So, I mean, it's always a difficult one when somebody is feeling vulnerable and perhaps reacts in that way, or somebody has been affected by the treatment in itself. They may not be aware of those effects, and also, I mean, it's important to know that it has other effects, like, for example, some men may experience erectile dysfunction, and that in itself, even though the partner might not be so concerned about it, could be quite concerning for the men. And we know that experiencing erectile dysfunction in itself increases your risk of depression quite significantly, much higher than people going through treatment that don't experience this particular side effect. Also, if for whatever reason, I mean, this is hormonal treatment, so it's unlikely, but urinary incontinence is the other one that actually increases your risk, and increases your risk of isolation, increases your risk of being irritable and difficult with others that are trying to support you. I think, you know, it's about listening to him and try to sort of bring this to his attention in the gentlest possible way, and perhaps encouraging him to seek help for that specifically. I'm sure that, you know, that they might not have considered that there might be, the mood may have changed, but opening up the conversation about the mood and well-being might be a way in, maybe something less threatening. You know, I noticed that you're going through this treatment, even though the prognosis is good. You seem to be feeling a little bit under the weather, and you seem to be relating to us in which that are different. And perhaps, you know, I don't know if you know, but the risk of depression and other conditions can go up, and it might be a good idea to perhaps see if this can be, if this is an issue here, and this can be alleviated. As I said, sometimes it's quite difficult to open up that discussion. I fully acknowledge that, but it's very much about sort of listening and trying to sort of understand that it is probably the side effects of the medication. I know that it doesn't help in the moment, but try to sort of be there and encourage that gently, that help seeking for themselves, because this might not be clear to the family because they are so irritable, but they might be quite distressed in themselves if they are reacting in that way, and we don't know exactly why. But it's about encouraging them to perhaps take that step and seek extra help, perhaps making them aware that the treatment might be affecting them in various ways, and that it might be worth consulting on that topic specifically. They've accepted the treatment, so they may be open to a conversation with a prescriber around these topics. I'm sure John has better ideas as well.
Well, thanks, Andres. I'm not sure about the better ideas, but it certainly kind of falls on from what you said. And maybe putting my previous hat on, where I worked as a psychiatric nurse for many, many years, where I would be interacting with people who are often very irritable and even aggressive at times. I think one of the things I always remembered from my training was that I had to have that internal conversation in my head when I was communicating with somebody who was very irritable, and have that internal conversation that says, look, I know why they're feeling that way. It's to do with the treatment. It's to do with the diagnosis. They're under a lot of stress. So I think that can certainly help as a cue, as a mental stepping back, if you like. I also think sometimes, you know, we know that when you're living together and with a diagnosis of prostate cancer, and goodness knows what we've all had to live through the last 15 months, where we've been indoors a lot more, we've been with each other a lot more. That has compounded all of that. And I think sometimes it's useful just to give somebody literally a bit of space and just take that step back and say, right, I'll come back later and see if they're feeling a bit better at that point. But I think Andres's point is a good one about many men who go through treatment for prostate cancer, whether it's because they've had their prostate removed, they've had radiotherapy treatment, they're on hormone treatment. We know that that can have a significant impact on men and how they see themselves. The number of men that we speak to who will tell us that they no longer view themselves in the same way as they did previously in terms of their manhood, whether that's related to the loss of erectile functioning, whether it's to do with the loss of roles that they previously had, such as a job that they're no longer able to do. So there's complex issues there. And often men who are going through that process and you know, feeling unlike themselves and irritable and their mood is low, they may have conversations again in their own head about why that is. Is that to do with the cancer? Is it to do with the diagnosis? Is it to do with the treatment? And I think, as Andreas said, it's really useful to actually say to men in that situation, why don't you talk to somebody about it? Then, you know, again, men who go to support groups will tell us having the opportunity to speak to somebody else who can then say, well, actually, I went through a similar thing. And it's that big kind of aha, light bulb moment where they say, well, actually, it's not just me, it's actually to do with the treatment. And we spend a lot of time in our phone service talking to men, explaining to them, if you're on hormone treatment, our hormones don't act independently of each other. We have a lot of hormones in our body which fulfill lots of different functions, such as regulating our temperature, helping promote our sexual drive, our muscle bulk, whatever it might be. Once you disrupt hormones in the body, it has lots of knock-on impacts, which can present in these sorts of ways, such as irritability and low mood. And when you explain that to men, it certainly makes a difference. So I think, yeah, by all means, if you're with somebody who's experiencing those issues, then get them to give us a call, or indeed give us a call yourself, because we do speak to partners and we can help to sort of act as a safety valve for partners often.
Brilliant, thank you. And John Rebholz, from your experience, you know, you sort of said that you had that open dialogue with your dad. Did you ever experience sort of times where, you know, he was less reluctant to be open, and what was that kind of conversation or that journey like for you?
Yeah, I mean, it's a very complex issue, isn't it? I mean, there are lots of negative factors feeding into, you know, a patient who's going through some sort of terminal illness, any form of illness, but particularly, I think it is, like the panel have said, it's understanding, like doing a sense check, understanding where they're at. Obviously, I sat with my dad. If he didn't want to talk there and then, I knew if I sat with him, he might want to talk, and he did often. He just wanted to have space. I think that's equally important, that you give them their time to kind of work their thoughts out. And invariably, he would open up. When I sat with him, I was there, he would open up. And sometimes the worry would be so simple as that he was worried about money. He was worried about what happens when you know, when he goes, what happens to the family? What happens to, you know, my mum, his wife, about finance, and you know, we can talk these things through and break it down, and then move on to the next question. But there are times that, you know, potentially that you can't really answer all the questions, and you just have to, you know, hold his hand. I remember sometimes he has such swollen feet because of treatment. He would just like me to be there in a kind of comfort role, and I give him a nice foot rub. Just, yeah, I mean, you know, even a hug. I mean, we're all human after all. It's just knowing what is best for that sort of individual, and it's hard to say that there is like a magic bullet, because there isn't. I think just the love and support that you can give. I know that hormone treatment can actually have a massive impact on your outlook. But there are things that you can do, and if they can still walk, and if they're still quite mobile, then go for a walk. It's amazing what just a bit of fresh air would do, and just a kind of change of scenery. But that's my experience. Brilliant,
thanks, John. I'll just move on to a couple of questions that we've got in the Q&A now really quickly. So we've had one from Loretta around the words palliative care. And do you think that terminology has a negative impact on the mental health of a person diagnosed with prostate cancer? Because the implications of palliative care is that the disease has progressed to such a stage that it's terminal. So do you think that do you find in your experience, John Robertson, I'll come to you with this one, that the term palliative care has a negative impact on people's mental health? Or yeah, what are your thoughts on that, John?
Yeah, thanks, Loretta. It's a really good question, and it's one that we hear a lot about when we speak to people on the service that we offer. Again, I think it's to do with the way that palliative care has been represented in society. That the fact that somehow it's perceived as being that it's an end-of-life experience, and that therefore the person who's been referred to palliative care is about to have their life shortened quite significantly. And I spend a lot of time actually explaining palliative care has a really great role to play in supporting not just the patient, but their family, and maintaining the best quality of life for the patient at that point in time. Palliative care services have really reorientated themselves for a good number of decades now to provide that kind of service. You know, there's a term holistic care used quite a lot in health, and it is really around that experience of how can you help support somebody going through that experience. So it isn't necessarily a signal that the person's life is about to end.
Great, thank you. We also, sorry, Laura, you go.
Oh, no, sorry, I didn't have anything. Apologies, I might have hit my microphone by mistake, sorry.
No, that's okay. We also had another question around medications that are used to treat the mental health aspect, and whether there are any, whether they have an effect on treatment. And Andreas, I know that we did talk about that in terms of sort of if you're on current medication for a mental health condition, sometimes that can interfere. So are you able to talk about that in terms of any medications currently that might impact or impact treatment?
Yeah, no, I mean, in general, medications that are used for depression and anxiety tend not to interfere with very many things, particularly the more modern ones. The older ones did have complex metabolic pathways that may interfere with other tablets that you might be taking, but currently no. I mean, it's the odd interaction. So the thing to understand is that there should be a good communication between the teams, right? So that if you are under the care of a psychiatrist, or you're contemplating initiating treatment with medication for anxiety or depression, for example, that is communicated very well to the GP and to the cancer specialist. And also whoever's looking after the mental health of the individual needs to know what the treatment, the cancer treatment, the hormonal treatment is, just in case there's any of those interactions or anything that is going to interfere, or something that you know that you need to sort of take into account in terms of the dosage or other things that you might be considering for your treatment. But in principle, no. I mean, it's perfectly compatible. You could be, looking at, doing your whatever treatment the oncologist or the urologist is prescribing, and also following your mental health treatment, so long as there's very good communication between those teams and is very good. And in particular, the GP needs to be well informed about what the specialists are doing, so that there's no miscommunication and there's none of those issues.
Brilliant. Thank you. Thank you all so much. I can't believe that we're almost at the end of our time. I've just put the further support slide up so you can contact Prostate Cancer UK if you have any questions or want any advice or support yourself or for a family member. I also just wanted to ask John Robertson to briefly talk about the one-to-one peer support service that you have at Prostate Cancer, because you mentioned that in our prep meeting. I think it'd be helpful for people just to understand what that service is and what it can be used for, and if it's just for people with a diagnosis or whether it's for family members as well.
Yeah, thanks, Emily. This is a service that we've been offering at Prostate Cancer UK for many years now. And it's a kind of recognition that, as much as it's really helpful to speak to nurses and indeed doctors about all aspects of prostate cancer, it can be often not a substitute for speaking to somebody who's actually experienced the sort of situation themselves. And that's what our one-to-one volunteers are about. They're people like John who kindly offer their services to the charity and who are happy to speak at the end of a phone to somebody who wants to talk about their particular experience. So indeed, it may be about treatment. We often signpost a lot of men to the one-to-one who are perhaps considering surgery to have the prostate removed or radiotherapy or whatever. But it's also about partners. And often we have partners ringing us saying, is there an opportunity to speak to somebody who's been a family member or a partner of somebody who's going through a similar experience? So yeah, by all means, if you feel that would be helpful for you, then you can access that service quite simply through the links that you can see on your screen.
Brilliant. Thank you, John. So thank you so much to all of our panelists for giving your time today. And I think there's been some really, really helpful information, and we've seen some comments through the chat of family members that have felt like they've kind of learned something from today that they can take away to help support their loved ones. So thank you very much. Thanks everyone for joining. We will share this recording with you all afterwards, and it'll also be available on our YouTube channel, so you can share it. You'll also find recordings of our previous webinar that we did, which was talking more about prostate cancer itself and what that might look like, and the process of diagnosis and so on. So you can find all of that on our YouTube channel as well. So thank you very much. Thanks for your time this morning, and I hope you all have a good rest of your day.